Premature ejaculation, part 5, treatment, diet, and medication. Unfortunately, about the diet, specific diet and food and premature ejaculation, still we don't have any good and reliable research. But about the diet and erectile dysfunction and libido, we have many study that I'm not going to talk about that in this, but about the premature ejaculation, we don't have such a study that we can judge based on that. There was a good review by Dr. Justin Law and his colleague about those on the over 28 study that has been done for relationship between the hypogonadism or low testosterone and diet, and other group with the diet and sexual dysfunction. They found that generally Western diet that is based on the processed food and refined grain, that is the most important differences between those Western diet and other diet, show that they have more problem as related to those metabolic disorder and cardiovascular disease that will be common in this group. On those other Mediterranean and Paleo and the veg, they have better health situation and especially cardiovascular, and we know for function of the our sexual system, we should have a good cardiovascular and neurologic functioning. But still we cannot judge is any specific diet or any specific food or fruit or vegetable can help premature ejaculation. We don't have data. One thing that has been proved that there is an association between the deficiency of vitamin D and premature ejaculation. For that reason, beside of those other evaluation like the thyroid function and blood for the diabetes, is better we check for vitamin D level of the blood. If it's low, with replacement of vitamin D, usually premature ejaculation improved. There are among the different culture and region, there are some belief that some specific food can improve premature ejaculation, like that some seeds or seafood like the lobster or oyster or banana, honey with the garlic and all other. Each region has their own thing and thoughts, but we don't have any evidences. Generally, if it's up to your personal experience, if you eat some specific food that it help you, why not give it a shot? But otherwise we don't have evidence. For relation to the diet and lifestyle, we can recommend one thing, these things that I'm going to talk about. That first, losing weight. It showed that all those people who have overweight, losing weight improve their premature ejaculation. That is the first step. Second, we should have a balanced diet, especially organic food, not the processed food. If we eliminate any type of processed food, it can help, especially those we know use there are a lot of additive and preservative material during preparing. So if we eliminate them, it will be great not only for premature, for our health. Another, increasing seafood, especially those foods and fruits and vegetables that have high level of magnesium and zinc. It will be a little helpful. And the last one, the most important part, having a regular exercise. The regular exercise means having physical activity that heart rate goes around 100 to 120 depending of the age, but we have at least every other day 30-minute activity. The activity is not just only increasing heart rate, but it's connecting with the environment and nature and other people. It's not that you go jumping to the gym and just listening to music and running. Even though is better than not doing that, but the best way for getting benefit of the exercise is that if you go to the nature, jogging or running or any other activity, nature, that connection with nature and our emotion and feeling and enjoying that moment, that is the most important part of the regular exercise that can be very helpful for our health and especially for premature ejaculation because improve the circulation and nervous system in our body. About medical plan or health, unfortunately, we don't have many study and researchers about the libido and sex drive and erection dysfunction. We have some research and good herb that can be helpful. Among them, uh, ginkgo, ginseng, yohimbine. Those are very good for the uh, libido, and yohimbine especially for erection dysfunction, and damiana. But about the premature ejaculation, we have only one study, small study over about 60 patients that they used a combination of the multiple vitamin B, B12, B6, B5, and some other element and some herb. That still is a very small study for better result. We have to wait for more investigation and research. Drug and medication related to the premature ejaculation divided to two groups. One group causes premature ejaculation, another group can uh, help for treatment of premature, not treatment, helping improve premature ejaculation. Those drugs that can cause premature ejaculation in some percentage of the people, not always, are those drugs that increase the dopamine, the neurotransmitter that is involved in some process of the orgasm and ejaculation. At top of them are some anti-Parkinson drugs, including, for example, like L-Dopa, some antipsychotic drug like the chlorpromazine and other haloperidol and other antipsychotic, and amphetamine. The other group of the drugs that can cause premature ejaculation are those drugs that increase the autonomic nervous system discharge, especially sympathomimetic. It increase those neurotransmitter and cause premature ejaculation. At top of them are those anti-congestion drug that we use is very common in the many of those cough or cold medicine. Many of them they have it, or those some of the anti-asthma medicine. Some of them they have it. Another are those MAO inhibitor. Is abbreviation for monoamino oxidase inhibitor that usually used for the some specific type of the depression and sometimes Parkinson and some other neurologic disorder, and amphetamine, and finally cocaine. Those are medication that can cause premature ejaculation, and if you have this problem, always check your medication with your uh, doctor. In other group, we have medication that can help for treatment of premature ejaculation. Fortunately, we have a lot of new researchers that show many medicine can help those group of the people, but there are some problems. First of all, none of them has been approved by FDA for using premature ejaculation. This is first of all, in some country they are allowed it and they are starting to using some of them, but still we should wait for more research and data, and finally waiting for FDA until approve any of them. Among those medication, we have to keep in our mind that most of them they need to be taken every day, and the result will be show up after a few days to few weeks. Is not right away. Only among those medication, only three of them can be used before sex in hand. So 1 to 2 hours before intercourse, we can use it, and they are effective. The top of them is dupoxetine, tramadol, and those other two medication that is very famous for, even they are the main reason we use is for erectile dysfunction, but they can help a little premature ejaculation too. The other medication should be taken daily. And we have to know that all of those medication has many serious side effects, and the indication for taking them is only for beginning of treatment in some people. That is very critical. For example, some people with the penetration anxiety, so those people will get benefit a lot from this medication. Or those other people, they have genetic or primary premature ejaculation from the first time in their life up to the after that, they have that problem that I explained in the first clip, that they have some problem in their uh, receptor for serotonin. So in those cases, this group of medication will be very helpful until, but the other situation, we have to always go and get it correct, and the more effective treatment that we talk about, those psycho behavior therapy, exercise, sex therapy, and all those other life changing and all other topics that we talk about that. And one more thing that I want to mention, because those medication has very serious side effect, we shouldn't take them by ourselves, and always we have to take based on the doctor prescribe and be under observation for any serious side effect. Next clip will be about delay ejaculation and anorgasmia that is very common among women. Up to the next time. Have a wonderful time.